Hi, and welcome to the bonus video as part of the Nurture Life Online Childbirth Education course. This bonus video is about postpartum after a cesarean. I originally planned to include this as part of the 4-week course, but I ended up wanting to include so much information that I decided it needed to be its own standalone bonus video. Our goal is to understand what a normal, healthy, and safe pregnancy, labor, and childbirth look like, and then what to do if something outside of normal arises. Also, our goal is to avoid any unnecessary cesarean surgeries as they are accompanied with other risks. Taking this childbirth education course and aligning yourself with a supportive and evidence-based provider are two key components to ensuring you don't end up having an unnecessary cesarean surgery. As I have said often throughout this course, gaining knowledge, stating your preferences, and then preparing for the unexpected, including a cesarean birth, are very important to ensuring you have a positive, safe, and empowered birth experience. I want you to hear me when I say this. No matter how you give birth, your birth matters. How you are treated leading up to your birth and during your birth and after your birth, it all affects you and has the potential to last a lifetime. So, to ensure you have the best birth possible, including a happy and healthy mama and baby, you will want to include preparing for cesarean birth as part of your pre-birth preparation. Knowing what a cesarean birth will look and feel like and what the postpartum experience will include will help you to better advocate for yourself and ensure you continue to receive the care you deserve no matter what arises during your birthing experience. Today, you will learn about how to prepare for the unplanned and planned C-section and what to include in your birth plan. We will then dive into physical recovery, breastfeeding, emotions, support needed, and additional things to consider if you need a C-section. I am excited to share this class with you today. Are you ready to get started? Let's do it. You can't plan your birth, and that isn't the point of a birth plan. So don't be discouraged if you hear someone say that birth is unpredictable. Why have a birth plan? The point of a birth plan is to help you have conversations early on with your care provider about your preferences and working with your birth team to ensure your preferences are in line with the care being offered by the provider and the hospital. The birth plan is helpful in allowing you time to work through each area of the birth and think about what may occur, and that if you had a choice, what would your choice be? And then how to handle it and what questions to ask when something outside of your plan occurs. This entire process can be very beneficial, and it also applies to if you need a C-section. Having a C-section for most is not what you ultimately want, but it may be what you need, and it may be planned or unplanned. Many women deliver their babies by cesarean, whether it be planned or unexpected. Understanding what to expect and talking with your provider and learning about these things before the birth can be helpful, so you know what is an option and what is not an option. If you are planning a cesarean, write a birth plan. If you are not planning a cesarean, write a birth plan. I encourage you to write a separate cesarean birth plan to address the areas that are most important to you and to ensure that no matter what type of birth you have, you feel satisfied and confident with your care and decisions. You may be wondering how you can have options in a surgery at a hospital, but you can. So what options do you have? Well, to understand more about this, I want to share with you about the gentle cesarean, also known as family-centered cesarean. If you aren't already familiar with what this is, let me fill you in. In a typical C-section, a closed curtain shields the sterile operating field. Mothers don't see the procedure, and their babies are sometimes immediately whisked away for pediatric care, a separation that can last for close to half an hour. A gentle or family-centered cesarean involves techniques that are relatively easy, and the main goals are simple. Let moms see their babies being born if they want to, and put newborns immediately on the mother's chest for skin-to-skin contact. This helps stimulate bonding and breastfeeding. Next, I will share with you several tips to make your cesarean birth as gentle and family-centered as possible. Use these tips to help create your cesarean birth plan and discuss these items in advance with your healthcare provider to see what is possible in your situation and in your place of birth. 1. Based on the health condition which necessitates the cesarean, see if letting labor begin on its own is an option, as this has benefits for both mom and baby. 2. If time allows, take a moment to talk to your baby. Let him or her know what will be happening, that you have confidence in your team and your baby, and that you will soon be holding him or her in your arms. 3. Walk into the operating room if possible. It is very empowering to move to the OR under your own steam if you and the baby are stable. 4. Ask for 2 support people in the operating room. That way someone is always with you and the baby. 5. Bring in music of your choice that can be played during the birth. 6. Ask that everyone in the room take a moment to introduce themselves before the surgery begins. There are several more people than you might expect in the OR during a cesarean birth, and everyone may look the same, all gowned and masked. It can feel a little more personal to hear their staff introduce themselves. 7. If you were waiting to discover the sex of the baby at birth, you can still do that. The staff and surgeons do not need to announce boy or girl, but instead can leave that to be discovered by you and your partner. 8. Ask if it is possible to delay cord clamping for even a very short amount of time if baby is stable. Even 30 seconds of continued pulsing can provide benefits to your baby. 9. Consider bringing a little cotton ball or gauze pad with some peppermint oil dabbed on it in a Ziploc bag. Peppermint oil can reduce the nauseous feeling and help you to not vomit. There is medication that can be given to you during the operation, but it may also make you sleepy. So if you can avoid it, that's great. 10. Ask if you can have the drape lowered at the moment of birth, or alternatively, if your hospital has a clear drape, this will allow you to see your baby as he or she is being born, but will still prevent you from seeing the surgical site. 11. Ask your partner to tell you what is going on and what your baby looks like if you are unable to see. Talk or sing to your baby so that your little one can hear your voice as he or she makes the transition to the outside world. 12. Ask if you can bring baby to your chest immediately after birth to start skin to skin. If you're unable or prefer not to have skin to skin in the OR, consider letting your partner have some skin to skin time with the baby while sitting next to you. 13. Ask that all possible newborn procedures be delayed until after you have returned to your room with your baby and had a chance to breastfeed. This is keeping in line with protecting the golden hour after birth as much as possible. 14. Ask that your uterus be double layer sutured. While current research is not clear that this provides any advantage over single layer suturing, should you wish to attempt a vaginal birth after cesarean with a subsequent pregnancy, some physicians are more comfortable and supportive of the VBAC attempt if there has been a double layer suturing during the repair. 15. When you return to your room and get a chance to spend those first minutes really holding your baby and initiating breastfeeding, try and keep visitors and guests away for just a little bit so you and your baby can get a chance to get acquainted on the outside. This time is precious, and the fewer distractions the better to help you and your baby connect and bond. Use these tips and topics to help create your birth plan and use them as discussion points with both your care provider and your partner. Doing these things now can help reduce stress and uncertainty if the need for cesarean arises for you. Here we will discuss a few other things to consider and to discuss with your care provider before the birth, even if you do not plan to have a C-section. It is important to know what to expect if you do need a C-section and what your options are specific to your provider and birth location. Preparation before the birth can lead to a more satisfying birth no matter how it unfolds. The first thing we will discuss here is about gut bacteria and the microbiome and how it is different for a cesarean birth than a vaginal birth and how it can affect health. The gut bacteria inside humans has been found to be responsible for many health factors. When a baby is born vaginally, their gut becomes colonized with the beneficial bacteria found in the birth canal, as well as on their parent's skin if placed immediately skin to skin. This gut bacteria forms the basis for a typical microbiome that plays a role in a healthier immune system. When born by cesarean, baby misses out on this bacteria and instead is colonized initially by bacteria that's found in the hospital. Without normal bacteria, babies and children have a little bit harder time fighting off disease and may experience developmental delays. Research continues about the potential benefits of artificially colonizing baby's gut with birth canal bacteria by swabbing with gauze, like you swab the baby's mouth after a cesarean. This is called vaginal seeding. And if you are interested in learning more, I highly encourage talking to your doctor or midwife about seeding your baby's gut if you need a C-section. Next, we will discuss cord clamping. We discussed cord clamping earlier, but did you know that cord clamping can still be delayed after a cesarean? Be sure and ask your doctor about delaying cord clamping 1 to 2 minutes or as long as possible in the event that there is a cesarean birth. Next is skin to skin. As you know, and as we've already discussed, skin to skin is important, but it could be delayed. Holding baby skin to skin immediately or as soon as possible after birth is important for transferring healthy bacteria, as we just spoke about, as well as maintaining baby's temperature, initiating breastfeeding, and bonding. With a C-section, it is most common for a baby to be transferred immediately after surgery to the warmer by the hands of the doctor and nurses. Talk to your doctor about your desires for skin to skin to find out what's typical in the hospital where you plan to give birth. Next, we will talk about baby's lungs. After a cesarean, the baby will have extra fluids to expel. During a vaginal birth, baby gets the long, extended squeeze through the birth canal, which isn't just a necessary evil. It helps squeeze fluid from the lungs in preparation for healthy breathing. With a C-section, babies don't get this big squeeze, so they may have extra fluid to contend with. This may mean that they experience difficulty breathing. They might cough up some extra fluids or sound juicy as they breathe in the first few days. Best thing to do is let labor begin on its own before having a cesarean if possible, and talk to your doctor about your baby's or your baby's pediatrician about what to look for with breathing complications. The last topic we will cover on this section is about bonding. Delayed skin to skin or being separated and maybe difficulties processing the birth and any related trauma can all affect how well you and your partner bond with your baby. Delayed bonding can be difficult to deal with, which may lead to feelings of guilt and inadequacy, which can play into postpartum mood disorders. Work on letting the guilt go and reminding yourself that the delayed bonding is not your fault and that with time and support, you will have a wonderful bond with your baby. Give yourself grace and patience and know that this looks different for each person. C-section or vaginal birth, it is possible for there to be a delay in bonding, and that is okay. If, after some time has passed, you are still not feeling a sense of bond with your baby, be sure to seek support from family, a postpartum doula, or a therapist. Make sure you attend your own health and well-being as much as your baby's. Now, let's talk about what occurs immediately post C-section, as well as what happens the first few days after your C-section and caring for your incision. What occurs immediately post C-section? C-section recovery is something that is done in stages. Right after your cesarean surgery is over, you will be wheeled into a post-operative recovery room. Usually there are several beds in one room separated by curtains. You will remain in recovery for a varied amount of time, depending on your anesthesia, whether it be general or regional. Typically, it's about a 2 to 4 hour period, or if you had an epidural or spinal, about the time it will take for you to wiggle your toes. If you've had general anesthesia, you may fall asleep and wake up repeatedly and possibly feel nauseated. As you move to your regular room, some of your equipment, including your catheter, blood pressure monitors, and IVs, will come with you. The catheter will usually be removed the day after your surgery. The IV will stay until your intestines begin working again. Avoid carbonated drinks or hot or cold drinks, as they tend to cause gas pain to be worse. You will feel pain from the surgery, and it's important to deal with it early on, because the less pain you feel, the more likely you are to be up and moving about, which is key to a speedy recovery. Some patients will also leave the surgery with a special pump on their IV that allows them to dispense their own IV pain medications when it unlocks every so often. These are used mostly for the initial 24-hour period. Medications will get into breast milk, and some are better than others for nursing mothers, so talk to your doctor and the baby's doctor about what is right for you and the baby. During the first few days post C-section, the best advice for recovery is to begin to move as quickly as you can. You will want to start out with simple things like breathing. While breathing sounds like an easy thing, a deep breath is not that easy after a C-section. Remember to begin to do this early and often. Now we will discuss your incision after a C-section. Don't be afraid to look at your incision. It's actually very important that you do so. The first day it may be covered by gauze, and some women may have special drains to help remove fluids that are collecting on the inside. There are different types of external incisions that may not match the incision on your uterus, so make sure you ask your doctor who did your surgery about the uterine incision. The area may look bruised, red, and irritated. You will notice that there are staples or stitches. These will usually be removed within a few days of the surgery, or will dissolve on their own, like the internal stitches. Looking at the incision now will allow you to be able to report changes that may indicate infection to your doctor at a later date. One thing that surprises many women is the numbness and itching. Numbness after C-section is completely normal. This is supposed to go away within a few weeks, but doesn't always. It doesn't indicate that there is something wrong, but just it's good to know. The best advice that anyone can give you, whether you're at home or in the hospital, is to rest. Rest is very important after any birth, and particularly true when you add the surgical aspect, even if you did not labor. Ask that visitors wait for a while, and ask the hospital staff to help keep interruptions to a minimum. Once you are home, be sure to ask for help from your friends and family there too. Next, we will talk about your baby and your emotions after a cesarean. Your baby may need special care, particularly if that was the reason for the cesarean, so he or she may spend extra time in the nursery. If this is the case, ask that your bed is wheeled to the nursery or a wheelchair as soon as you are able to. If your baby is doing well after the birth and is healthy, you may be able to hold your baby through the entire recovery room period, bringing the baby to your postpartum room with you. Even if you are feeling sleepy or in pain, your family members or support person can help you with the baby while in your room. Your emotions, as with any new mom, will probably be all over the place for the first few days. In addition to the new mom feelings, you may have certain feelings about the birth if it does not go as you had hoped. You may be afraid when they tell you that you need a cesarean, that something is wrong with you or your baby. You may feel disappointed about the way things went, or that certain things didn't happen, like a vaginal birth or breastfeeding your baby in the recovery room. It's okay to have these feelings or questions. Ask your doctor or midwife, your partner, or the nurses questions about your C-section, which can help explain why the surgery was necessary. It's important to realize that these feelings need to be dealt with just as much as the physical healing. Some women don't feel negative about their cesarean at all, and that is awesome. There's no right way to feel or be after you give birth. The only thing we know for sure is that life has been significantly impacted, and you will need time to adjust, process, and soak it all in. New moms need to be supported as much as possible as they transition from pregnancy to birth and through the postpartum. Whether it's planned or unexpected, the surgical delivery of a child can affect breastfeeding. That doesn't mean you can't or shouldn't breastfeed. Breastfeeding is very much possible after cesarean, although the positioning may be a bit trickier with your incision, but with good support and a few techniques as well as time and patience, you can have the breastfeeding relationship you desire. Pain medication can help relieve some of the incision pain that can be worsened during breastfeeding. A lactation consultant at your hospital can help provide tips and techniques for getting started in the right direction. It's helpful to understand the breastfeeding challenges you may face after a C-section so you can prepare for them. Some common experiences include delayed start to breastfeeding, incision pain, a sleepy baby, delayed milk production, and the emotional toll of it all. After a C-section, you may have a delayed start to breastfeeding. Depending on the type of anesthesia you have, and your baby may be a little bit sleepy for a while after the procedure. If you have general anesthesia, which is rare, you will be able to breastfeed once it begins to wear off and you are feeling up to it. With an epidural, you may be able to breastfeed while you're still in the operating room. More commonly, you will do so shortly after the surgery in the recovery room. Pain from the incision site and after pains from the uterus contracting back down to size can make it very uncomfortable to breastfeed. Side lying is a great position to nurse because it takes so little effort on your part and the baby avoids the incision. The football hold is also great, so prop up with a lot of pillows for this one. To nurse while you're sitting up, you can place a pillow over your incision site to protect it. It may be tough in the beginning, but breastfeeding will get easier as your body heals. Your baby may be a bit sleepier after the C-section, so just keep that in mind. It's very important that you take your pain medication after you have a cesarean section to help manage your pain so you can move around, which helps with healing and so you can feel more comfortable while nursing. Some medications are safe to take while you're breastfeeding, so be sure to tell your doctor if you will be nursing your child. Even though the pain medications will be safe for the baby, some of it may pass through the breast milk and make your newborn sleepy. The sleepiness caused by the pain medication is not harmful to your child, but it can be a challenge to breastfeed a sleepy baby. If this is the case, be sure and request a breast pump to help stimulate the breast and remove colostrum until your baby is ready to nurse. As with a vaginal birth, you will want to put the baby to your breast as soon as possible and breastfeed often to stimulate milk production. If you and your child are separated after delivery, for example, if either of you needs extra care, you will not have the chance to begin breastfeeding right away. So be sure to ask to use a breast pump if you will be separated for more than 12 hours so you can start to stimulate your breast to produce milk. Pump every 2 to 3 hours or until you can put the baby to your breast. Next, we will discuss the emotions surrounding breastfeeding after a cesarean. If the surgery was very difficult or if it was an emergency that you were not prepared for, your physical and emotional state may interfere with breastfeeding. A traumatic birth or unexpected C-section may cause sadness and a sense of failure. If the birth did not occur the way you imagined, you might also be feeling a sense of loss. These are common emotions, and you are not alone. Talk about your feelings and try to accept support when needed. Keep in mind that breastfeeding your baby may actually help you get past the difficulty and sadness. Lastly, the advantage of the extra time in the hospital. You will be spending a little more time in the hospital compared to someone who has a vaginal delivery. The big upside to this is that it allows you more time with the hospital staff and lactation consultant. Ask questions and learn all you can so you will feel more comfortable and confident when you get home. Consult with a lactation consultant early and as often as needed to help ensure a healthy breastfeeding relationship. I highly encourage asking to see the lactation consultant as often as possible during your stay at the hospital. I recommend this with vaginal or cesarean birth. Breastfeeding takes some adjusting to, especially after a cesarean, so to ensure success, be sure and use the resources available at the hospital as well as have a lactation consultant on hand to reach out to once you're home. The extra support provided by LCs in those early days and weeks can make all the difference. Also, if your LC is at all dismissive, rude, uncaring, judgy, or acts in any way that makes you feel anything less than the amazing, strong, smart woman you are, ask to see another LC or call a private LC if possible. A great resource I'd love to share about is the La Leche League. This group is for anyone newly postpartum and breastfeeding. They have local groups across the country as well as an online support and resources. The La Leche League also wrote the book Womanly Art of Breastfeeding, which is a very helpful book for you to read to prepare for breastfeeding, no matter what kind of birth you have. It can be helpful to read before the birth or after the birth. I highly recommend it. Birth is not only about making babies, birth is about making mothers, strong, competent, capable mothers who trust themselves and know their inner strength. Remember that your journey could look different from other women's journeys. Keep your head up, stay focused on you and your baby and what is best for your family unit. Tune out the outside opinions, listen to trusted resources, and ask for help when you need it. You've got this, Mama. Keep going. It is worth the work. That is the end of our bonus class on postpartum after a cesarean. If you have any questions, please feel free to email me directly and I'll be happy to discuss further and help you find the information needed to help put your worry and concern at ease. If you like to journal or write things down, be sure and write down how you are feeling and your thoughts immediately after watching this course so you can capture exactly where you're at and come back to it later on when it's time to write your birth plan or have a conversation with your provider. Thank you for your time today. I hope you found this information useful as you prepare for your upcoming birth.